I'm Jaimie, a homeschooling mom of four, doula, and international board certified lactation consultant, and today I'm going to answer your questions on tongue ties. We're going to go over the most commonly asked questions about tongue ties, and I want you to go ahead and drop your questions in the comments so that I can address them in a later video as well. Before we get started, if you are new here, go ahead and make sure you hit the subscribe button, and there should be a little bell that you can click to get notifications so that every time I share a video on tongue ties, breastfeeding, birthy stuff, you can get notified and watch it and see if those tips help you. Information on tongue tie and breastfeeding support is really near and dear to my heart because all of my babies had tongue ties. And I really struggled breastfeeding my first because I didn't have good support. I didn't have access to much information. He was born in 2014, so it was still not as commonly talked about with tongue ties, and there's still a lot of barriers to that. Bigger cities seem to have more resources. Smaller towns like I was in, it was like, tongue tie, what's that? That doesn't exist. So we're trying to get the word out more, and a lot more people are aware of tongue ties and the impact they can have on breastfeeding, but there's still a lot of questions out there. So I want to make sure you are getting your questions answered so that you don't have to struggle. Make sure you hang out to the end of the video because I am going to share 3 ways that you can get free breastfeeding support today. All right, question number 1. What is a tongue tie? You know, a lot of people say tongue tie, and a lot of people think they know what it is, and it turns out it's not quite as obvious as you would think. So tongue tie is the conversational term for ankyloglossia, which translates directly to anchored tongue. Essentially, this is when the skin that forms the frenulum between the tongue and the bottom of the floor of the mouth is tight or tense or dense, and it doesn't allow for full range of motion of the tongue. So it is basically skin under the tongue that affects mobility. However, a lot of times people will say like, oh, I have skin under the tongue, so that means I have a tongue tie. Not necessarily true. Vice versa, people might think like, oh, well, there's not enough skin there for it to be a tongue tie, or it's not in the right place for it to be a tongue tie. Also not true. It really depends more on how the frenulum is affecting tongue function, if that makes sense. So you could have a very posterior, which means very far to the back frenulum that is very short and inelastic and restricts you from lifting the back of your tongue. That could be a tongue tie. More often, people kind of associate tongue tie with the skin at the tip of the tongue that doesn't allow you to lift the tip of the tongue or stick it out. That's also a tongue tie, but that's where a lot of debate and controversy starts to come into what is a tongue tie? Is this a tongue tie? I have skin there. My baby has skin there. Does that mean it's a tie? Is it normal? Same for lips. We'll talk about that another day. Next question, what causes tongue tie? This is a very common question because people are like, is there something I did wrong? Is there some way I can prevent a tongue tie? And the truth is, we don't really fully understand exactly what causes tongue ties, but there's a lot of stuff out there that can impact whether or not your baby has a tie. There are many people who believe that it is related to some methylation defects. So if you have a certain gene, everybody's got the MTHFR gene, right? If you have a certain variation of that gene that doesn't allow for proper methylation of your genes, then that can result in a tongue tie. It can also result in a lot of other things and not result in a tongue tie. It's hard to say. There's a lot of hypothesis out there that folic acid in place of folate kind of exacerbates this issue of proper methylation and therefore can impact how those genes are expressed and whether or not your baby has a tongue tie. Other things that can impact breastfeeding is tension, trauma at birth, being low in the birth canal, like being engaged in the, not in the birth canal, but being engaged in the pelvis very early in pregnancy. So like 36 weeks your baby's engaged, but you don't actually go into labor and give birth till 40 weeks. That's 4 weeks of your baby being in basically stuck in a position, and it creates tension, which creates shortening of muscles, which can appear to be a tongue tie or act like a tongue tie or exacerbate an already formed tongue tie. And this also just brings up the fact that not all tongue ties or not all perceived tongue ties are specifically a tongue tie, but rather it's a tension issue, tension in the craniofacial muscles, in the neck muscles, and all of that together kind of creates a perfect storm. Your baby could have a high palate and your baby just can't lift their tongue high enough because they have to lift their tongue high enough to the palate in order to breastfeed effectively. But if they have certain types of tension, that might not be possible. And if they don't have a widespread palate, you can see that there's a bunch of issues there. So there's really a lot of nuance to tongue tie, what causes tongue tie, and if it's even a true tongue tie. But the bottom line is you're having trouble breastfeeding, right? Or not, but you want to make sure there's not other issues that could be associated with this specific problem. So that kind of brings us to our next question is, can you breastfeed a baby with a tongue tie? The answer is yes, you can breastfeed a baby with a tongue tie. Now, this is going to be very unique because every baby is unique. Every baby is very unique. Every mom is unique. Every birth is unique. Every situation has so much nuance and so many layers that go into it that sometimes, like myself, I had a tongue tie as a baby and my mom was able to breastfeed me with no problem. I had a very obvious tongue tie at the very tip. I looked like a snake when I would stick out my tongue because it looked like my tongue would deviate into two. That's how severe of a tongue tie that I had as a baby, but my mom was able to feed me with no problem. My siblings were never diagnosed with tongue ties. Later on, looking back, I hypothesized that they had posterior ties similar to what my children have had, but my mom couldn't breastfeed them. And when we kind of have dug into, well, what was that experience like? We've kind of come to the conclusion, like, they probably had ties too. It just wasn't at the tip and very obvious. So people didn't consider it a tongue tie back then in the 90s and early 2000s. But she was unable to breastfeed them. So you can see that it doesn't necessarily matter how the tongue tie looks. If you're able to breastfeed your baby, it's about how it's impacting function. And that can be very different for every baby based on things like we talked about before, fetal position in the uterus, birth trauma, position during delivery, all kinds of things can really play into whether or not that tongue tie impacts breastfeeding in a notable way. And then there's babies who are gaining weight really well, mom's not in pain, but the baby is not breastfeeding efficiently. But she's told that because baby's gaining well and she's not in pain, that there's no problem. So baby's not actually feeding in an optimal way, and that can exacerbate issues later in life, but baby can breastfeed. So that's a whole, like, how it impacts you later is something we can talk about another time. But I just wanted to point out that sometimes it can impact breastfeeding and sometimes it doesn't, but it doesn't mean it's not there. It doesn't mean it's not necessarily a problem. Some things to look out for if you're suspecting tongue tie is difficulty sticking the tongue out, difficulty lifting the tongue, especially to the palate, difficulty sucking consistently. So if your baby is kind of like, suck, suck, I need a break. Okay, suck, 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 suck. Oh no, I need a break. Suck, suck. That's not a consistent sucking pattern, and that can be a sign that they are having trouble using their tongue effectively. Also, if you have pain when breastfeeding, sore nipples, damaged nipples, obviously if you notice thick webbing connecting the tongue to the floor of the mouth, those are all red flags that your baby might have a tongue tie and you might have trouble breastfeeding. Now, how do you fix that? Great question. Fixing a tongue tie is not an overnight procedure. Tongue tie release is not a magic bullet for fixing breastfeeding issues. And even if it seems like it is, you need to make sure you're doing a holistic approach. And what I mean by that is that you have a team of providers that understand tongue tie and how nuanced. It really is, because I don't want what happened to me to happen to you. And I'll tell you that. I finally figured out my babies were tongue-tied, got them treated. So my first, it was like this whole nightmare situation, got it treated. Second, I knew what to look for. We were on top of it. We got it treated before we had too many issues, and he was gaining weight well. I wasn't in pain. So we just kind of, moved on. I was not advised to do any special like myofascial exercises. I was recommended to go to a chiropractor, but I had taken him a couple times, so I thought like, oh, he went to the chiropractor once or twice, that's fine. But I didn't do like an ongoing care kind of thing to really make sure that he was being supported both before and after revision. And what ended up happening is, I'm not sure if his tongue tie has reattached. I don't want to say that it's reattached, but he has very weak oral motor skills, and it has impacted speech. It has impacted his airway. There's a lot of complex issues that we're addressing now because we didn't do the full approach earlier. And there's also other things that play into that, like excessive pacifier use, things like that. But the stress and trauma that poor child endured just through life, broken bones, etc. But all of that really plays into a good tongue tie release, and I didn't know that. So what I want you to know is how to fix a tongue tie is it requires lots of people. You should be working with lactation. Even if you're not planning to exclusively breastfeed, working with lactation is so important because lactation consultants know how to work with bottle-fed babies too. We know how the baby's mouth is supposed to work. So if the baby's mouth is not working properly, we can pick up on that. Even if you don't want to breastfeed, how your baby feeds at the breast can tell us a lot about what's going on with them. So if that's not optimal, if breastfeeding is not working well, even if you don't want to breastfeed, it's a sign that you need a certain level of support, and you don't have to breastfeed in order to get that support. Additionally, like I said, chiropractors, sometimes SLPs, craniosacral therapists, a CFT, which is a craniofacial therapist, OT, PT, SLP, I might have said that already. And then, of course, a pediatric dentist or ENT. It's going to really depend on your location, what kind of providers you have available. I tend to lead toward pediatric dentists in most situations, but you have to be very cautious with who you hire. You can't just hire any lactation consultant. You can't just hire any chiropractor. You can't just hire any pediatric dentist or any ENT to truly get a holistic approach for your baby's ties. So that's where things can be kind of tricky, is like you have to really, really vet your providers well. And we can talk about that more in depth in another video as well. But how do you fix a tongue tie? You get a multidisciplinary approach. You start before the tongue tie release. You start teaching your baby how to use their tongue properly, how to use their oral motor skills properly. You make sure all of their reflexes are doing what they're supposed to do. You make sure that their body tension is addressed. And there's a surgical component to it. And you have to continue a lot of that after the fact as well. It's not like I call my kids' procedure was a clip and go tongue tie release, and that's not always ideal for every baby. This question that I'm gonna share with you guys today that I get very frequently is, my baby is breastfeeding well, or my baby bottle feeds, he won't breastfeed but bottle feeds well. Should I really get the tongue tie fixed? And again, there's a lot of nuance here. It really depends on the baby, but the first thing we need to understand is, what does it mean to breastfeed well? And we talked about this a little more before, but painless breastfeeding and gaining weight does not mean your baby is using their muscles properly. They could be compensating, and compensating teaches them to use certain muscles inappropriately and never learn how to use other muscles properly. And it might not hurt, there might not be any outward signs of a problem, but they will crop up later in life. Trust me on that. So they might not still have great nursing skills. So first we need to make sure that they even are breastfeeding well. Just because things seem easy enough doesn't mean they're breastfeeding well. So a functional exam is really important. And like I said, just because your baby's growing really well with bottle feeding, that doesn't mean that fixing the tongue tie is not necessary. I totally support your decision to choose to just exclusively bottle feed, whether that's formula, breast milk, whatever you decide is best for you. But I think we have a tendency to get tunnel vision and say, oh, well, they're feeding fine on the bottle, so that's just the path we're going to take. And we're not thinking about the issues that can come up later from untreated ties, even in the first year. So a lot of times people talk about stuff later on, but even in the first year, I have seen a lot of babies that are not feeding optimally at the breast. They bottle feed fine, and then when they start solids, it is a nightmare. It is a nightmare for everyone involved, and everybody acts like they have no idea why. And it's like, well, you never addressed the tongue tie. They never learned how to use their tongue properly, and now they're trying to learn how to navigate swallowing with muscles that don't work right. And you're wondering why your baby doesn't want solids, isn't interested in solids, or straight up flat out hates solids. Well, there's a reason. It can cause feeding issues as toddlers. There's speech issues. It can cause snoring and airway issues, which can lead to dental health issues. The bones in the face don't grow properly. It can lead to ADHD-like symptoms. Like, there's a whole host of things that can happen when a tongue tie is not treated properly in infancy. Now, that is not to scare you and say that you have to treat a tongue tie or that any of those things will happen, because there are people that have untreated tongue ties that go on to live a healthy, full, I mean, everybody can live a healthy, full life, right? But like, they go on to not have dental issues and mental health issues, etc., behavioral issues, learning challenges, etc. But that doesn't, like, we don't have a way to know who's gonna have it easy, who's not. And a lot of times people do go on to have issues and they just aren't connected back to the ties that they had as a baby. It's just that connection is never made. And a lot of people don't want to make that connection because it seems like blaming, or there's a lot of guilt and emotion involved, and it is emotional. But understanding that we can nip this in the bud early and prevent a lot of issues later on, I mean, that's a big deal to me. And understanding when that doesn't happen, there's still ways that we can make it better later on is important. And we have to acknowledge, like, if we had addressed this sooner, maybe this wouldn't be so bad, but now we're in the situation we're in, so let's face it now. And of course, people can have all of those issues without having a tongue tie related, right? Like, or you can have it treated in childhood and infancy and still have other issues later in life. Like, none of this exists within a vacuum, and I think that a lot of people who feel like there's a lot of controversy around tongue tie, it's because they want everything to be magic bullet, clear, cut and dry, black and white, and it's just not. It's just not. There's a lot of nuance. We are people that are designed intelligently and miraculously, and there's no magic bullet to anything. None of us are one size fits all. And we have to be treated as a whole person. Everything in our body is connected. And when we are just looking through like a tunnel vision, we've got blinders on and we're just focusing on this one thing, that's not good for anybody. And I'm kind of going off on a tangent here, but I feel like tongue tie and breastfeeding is where this really shows itself, because there are so many controversies and arguments and disagreements between healthcare providers about tongue tie. And at the end of the day, it's not that tongue tie is controversial. It's not that it doesn't exist. It's that it's complex and it can really test the confidence and pride that a lot of providers have. And they don't like that. And that's where the controversy comes from. So I'm going to stop rambling now. I hope this answered some of your questions about breastfeeding, about tongue ties and newborns. And I want to make sure that I go ahead and get those 3 tips in for you that I told you earlier. There are 3 ways that you can get free breastfeeding support right now. And one of those ways is that you can take my online breastfeeding class. If you are pregnant, you haven't had your baby yet, you're planning to breastfeed, my free online breastfeeding class is a great resource to have a starting point, to lay a foundation on which you can build. Obviously, it's not going to prevent every breastfeeding issue, but it's going to give you a great starting point and a strong foundation. The other thing you can do is check out my blog over at littlebearlactation.com, where I have a ton of birth and breastfeeding tips that a lot of moms find very helpful. And the third thing you can do is see if your health insurance is working with the Lactation Network. If your health insurance is working with the Lactation Network, you are eligible for free breastfeeding support. So no out-of-pocket cost to you for breastfeeding support. If your insurance is not working with TLN, depending on your insurance, there's some other options. If you have TRICARE East, I am able to bill TRICARE East for you, so you don't have to pay anything out of pocket for your visit. If you have TRICARE West or Medicaid, unfortunately, I cannot bill insurance for you. They will not reimburse, they will not cover it, but you do get a good discount with me if you have TRICARE East or if you have TRICARE West or Medicaid. And if you go ahead and you're not covered by TLN, your insurance is finicky or whatever, there's a lot of different options that you have. You can use your FSA, HSA account to cover lactation costs, but if you apply for, I've got a special offer, okay? Special offer for you. If you apply for coverage through TLN and find out that your insurance is not working with them and you get denied and you show me that you got denied, then I will give you a 5% discount on your telehealth consult as well. So a lot of people can get free breastfeeding support through TLN, through their insurance. If not, I can give you a discounted rate and give you a super bill so that you can apply for reimbursement through your insurance company. I can't guarantee that they will reimburse you, but many times they do. So you have options for breastfeeding help. Breastfeeding help is available, it is accessible, and I want you to know that it's there. So if you have any questions about breastfeeding, go ahead, drop them in the link, or drop them in the comment section. I don't know why I said link. Drop them in the comment section below. If you want to ask me personalized questions about breastfeeding, you can go ahead and check out the links below. I have links to my class, links to my blog, and links to how you can check your insurance coverage. And real quick, before you go, make sure if you didn't already, you go ahead and hit subscribe, hit that bell so that you get notified next time I share a video. See you next time.